Hi, everyone, and thank you for joining us for the fifth installment of the Expert Series on COVID-19. My name is Christina Wolney, and I'm part of the Partner Experience team here at Q-Centrix. And today I'm here with Lisa Ganem, our Senior Director of Cancer Services, and we'll be talking about the impact COVID-19 has made to cancer centers and registries across the U.S. Lisa comes to us with over 15 years of experience in oncology data analysis and accreditation support in her previous organization, and now offers clinical guidance for our cancer services here at Q-Centrix. So without further ado, I'd like to introduce you to Lisa and have her tell us a little bit about herself.
Hi, Christine. Thank you so much for that introduction. I'm Lisa Ganem. I am a CTR. I've worked in the cancer registry for 15 years now. I started out as a medical technologist, worked in patient education for a long time, and then just by a fluke landed in the cancer registry. And through the years, I have learned to have a passion for accreditation for cancer programs as well as quality data.
Thank you for that background, Lisa. We're happy to have you here today, and I'm excited to dive in. Now, Lisa and I were talking earlier today about how she always has a word of the year, and I love her word of the year, specifically this year. So can you tell us a little bit about that?
Sure. Yes, I always start my year with goals and a word of the year to guide me. I think my word of the year was joy, but it's now impact because of COVID. That is what we hear all over the world is impact. So we're responding with our impact on patient outcomes by providing accurate and actionable data that will help with patient outcomes. This powerful data will make an impact on diminishing this disease, and we're very focused on that.
Yes, absolutely. So, as you know, this COVID-19 global pandemic has forced us to change how we do essentially everything. So, can you tell us a little bit about the immediate impact that Corona has had to oncology departments across the nation?
I've been speaking with a lot of our partners, and it's just really multifaceted because we have the folks that have a diagnosis and we have the folks that do not yet have a diagnosis. We'll call them the have and have nots. So, the have folks, what they're experiencing is deferred treatment. They can't get surgery, they can't get their infusions because of the COVID related delays, the social distancing, the guidelines that have come out by all the agencies. So we're having to look at other treatment regimens that are not necessarily the preferred guidelines. We don't know what the outcome is, and hopefully it's minimal, but that is definitely an impact for them. Then we have the have-nots, the folks who have not been able to get a diagnosis because of the reduced screenings or actually the pausing of all the non-essential screenings. I read in an article that over 80,000 people have been impacted by the lack of screening for cancer diagnosis. And this number will continue to climb as we see the different phase and timelines with still having paused treatment windows.
Yeah, and along the same lines, can you tell us a little bit about some of the things our partners are doing to ensure that these cancer compromised patients don't worsen due to COVID-19?
Yes, they are working tirelessly, adding hours to the weekends and to the evenings so that they can get more patients in because of everyone is required to have so much distance between them, and infusion centers just don't. I mean, the chairs sit side by side, and they are doing a lot of televisits like the rest of the country. It's just a big challenge, really.
Right, definitely. And you mentioned the long-term impact briefly. What are some predictions you have regarding the long-term outcomes as a result of the virus, specifically as it relates to cancer?
I think it's obvious, and on the surface, we see that delaying patient care is going to change their outcomes because we're going to have later stage with the delayed treatments. We're fortunate to have a really strong workforce of providers, doctors, and nurses, and a host of others that to minimize the negative impact. But we do anticipate that will be uh, lower patient outcomes than we would have seen before.
Now, regarding reporting to registries, how has this virus impacted cancer reporting, and where do you see this going as we evolve through this pandemic?
So based on our current cancer reporting guidelines, which is about 3 to 6 months after initial diagnosis, we don't expect to see an initial impact. But by
Mhm.
the third quarter of this year, we do expect to see a drop in patient diagnosis, mainly because the non-essential screenings have been paused. Colonoscopies, mammograms, those types of things that diagnose our top tumor sites.
Mhm.
What our plans to use what we plan to do with that time when we have a drop in diagnosis is to move our data to closer to real time reporting so that it will be more important for the cancer programs. They can monitor quality measures closely. So as we see that time found with a drop in diagnosis, we will move more toward that. And then at the beginning of 2021, we expect to see a surge in cancer diagnosis. And at that point, we'll be more prepared and positioned to handle the workload and move forward.
Right, and it seems like in doing so, we will be coming out of this pandemic actually ahead of the game, so that's great. And on a related note, can you tell us why the collection of patient data is more important now than ever, specifically as it relates to COVID-19's impact to these cancer compromised patients?
I think our data will be very important in the lessons learned. I think we will use the data to prepare for another pandemic type event. Hopefully, we don't have one, but we need to be as prepared as we can, and the data behind that will certainly help programs and agencies prepare.
Mhm. And can you give us some updates regarding the COVID-19 from across the different cancer registries?
We have gotten a lot of information. The main players, the accrediting agencies, and the standard setters have really come forward to bring best practices and guidelines to the current cancer centers. In fact, today, a notification came out that a consortium of the main players are putting together one document, like one source document for cancer centers as the phase out of recovery starts, which is exciting.
Mhm.
Be a lot less confusing. I think it's confusing now when something comes out from the medical oncology group and then something comes out from the surgeons group. And if they're not right in sync, then it's hard for cancer centers to know which direction to take. So this is a big move for cancer centers across the country.
Right, and regarding supporting cancer registries and centers across the nation, you know that Q-Centrix partners with more than 650 hospitals throughout the country. How can folks optimize their partnerships, and how should we be supporting people during this time?
So I'm hoping they will look to us for current data. We can add COVID-related elements to the cancer registry to look at patient outcomes, their patient outcomes. But another bigger thing we can do is we can work to put data entry into the nationwide COVID registry so they can have comparison data for their patients. In addition, we'll just work with the accrediting agencies to help use minimal resources to stay on track with compliance.
Yes, absolutely. Well, thank you, Lisa. That's really all the time we have today. So I appreciate all of your time and insights today, and I'm looking forward to learning more from our experts as we progress through this series. So thank you to everyone that has joined us today, and please stay tuned for the next episode in our series. Thank you.